controversial. Did you know that advocating aggressively for your...
Dr. Imogen, you are a healthcare professional, and I have a lot of respect for 85% of the healthcare professionals in our country. But what you have just said is so out of line. To imply that advocating, even if it may be aggressively for a family member, is having the opposite effect and potentially having a worse outcome for their care is ludicrous. Let me tell you a story. For those of you that don't know, I'm a medical mum. I have a 4.5-year-old who has had life-threatening, devastating seizures since she was 4 months old. For the first year of her life, I was that polite, kind, yes sir, no sir to the doctors type of parent, and I nearly lost her twice because I didn't advocate aggressively. When my child was 10 months old, she was having a seizure, a status epilepticus, I'm sure you'll be familiar. She had been seizing for 30 minutes and they got the seizures under control. And I told the nurse and I told a few of the practitioners in the room, I'm pretty sure she's still seizing, that's still seizure activity, I'm pretty sure. For 40 minutes, I was telling them, I'm pretty sure she's still seizing. Oh no, she's just twitching and jolting. No, that's the aftershocks from the seizure. No, she's fine, you're just stressed. Do you need to take a break? I gaslit myself. I must be silly. I wasn't wrong. It wasn't until the point that she projectile vomited and then continued to seize for another 40 minutes aggressively, another tonic-clonic, clocking 2 hours of seizing. Then they listened, then the code was called, and do you know what that resulted in? That resulted in my daughter being on a ventilator for 5 days. Coming off that ventilator, spending 10 days in total in hospital and having to go through drug withdrawal because she was in an induced coma. Had they have listened to me, would that have happened? I don't think so. Oh, could you please check? Oh, I'm just not sure. Oh, please. Doesn't work. It doesn't work. Prior to having my daughter, I would never question a healthcare professional, ever. Until the head of the pediatric neurology department overdosed my child on a benzo medication because he didn't check the counteractions with her other epileptic medications. And for a month, I watched my daughter in a vegetated state. And I thought, well, she'd been on a ventilator for a second time by this point, and she'd had a 2.5-hour seizure. Maybe she had brain damage. I was shunned off. I was pushed aside. I was made to feel like a hysterical mother until we went and seen another professional who found the mistake. Do you know what they did? They stopped answering my phone calls. And for 8 months, I had to wait to get her into a different hospital with no neurologist when my daughter has a severe neurological condition. Then I started advocating aggressively, and do you know what happened? Things started happening. Her care started getting better. Now, don't get me wrong, there's a difference between being straight up rude and assertive. I'm always assertive, but I'm always respectful unless you give me a reason not to be. Because again, a second time in a second children's hospital then overdosed my daughter on the same medication that we'd left the first one for. And for days and days, I told 2 separate hospitals that something wasn't right. I didn't feel okay. I'm really not sure. Are you sure our medication's okay? And again, I was made to feel like a hysterical mother. And one of the pediatricians went as far as to call my GP and tell them I needed anxiety medication. The fucking audacity. Turns out she was being overdosed on that medicine. And for months and months and months, she was in hospital and couldn't eat and needed a feeding tube and was like a newborn. So if someone is advocating aggressively, as you call it, I'd like to say assertively, there's a reason for it. If someone's being straight up rude and just tit for tat and just picking and just, then that's different. But never should it affect the quality of care or how you do your job. I very much understand burnout. I understand that medical professionals went absolutely through it with COVID. I get that. But if you are actively walking past a patient's door and not checking on them because you don't want to deal with their family member, that's an issue. I have had to go head to head with so many ED doctors, such as yourself, who have no idea what Dravet syndrome is. I am the expert in my child. I know her better than anyone. And unless you've dedicated your life to researching Dravet syndrome and the comorbidities of it, you don't get to tell me what she does and doesn't need because you work in an ED department. If that's aggressive to you, then maybe that's a you problem. Maybe you need to reflect on your people skills and why you're taking things personally. Maybe you need to reflect on how you're doing your job and why that might trigger certain advocates. Because when you come in and tell me that my child's fine and I know that she's not, then yeah, I'm going to get assertive. No, I'm not going to take no for an answer, because the other times that I've done it, I've nearly lost my kid. And sadly, there's so many examples in this country alone of people who have lost their children because they weren't taken seriously, or lost their parents or a loved one. Again, I have respect for you and what you do. EDs are an intense place. I've spent many, many, many nights in the emergency department, and I know that it's chaos, and I know that you guys are pushed to the brink and that you see things and do things that most human beings couldn't fathom, and then you go into the next room like nothing ever happened. I have so much respect for that. But actively avoiding patient care or saying that having a strong advocate is going to have a negative outcome on the patient's care, that's a problem. And that's precisely why we're aggressive advocates. Because to you, you go home at the end of the day, it's just a job. To us, it's our whole life. It's our loved one. As a full-time carer, this is my entire life. I spend all day, every day, caring for my child, making her comfortable, and keeping her here. So respectfully, I think you need to review your practices.